is a reference video for hooking up the MediByte sleep apnea recorder. You will want to start by laying out all of the parts to the MediByte machine in front of you. We have also enclosed a MediByte patient guide for your reference. A helpful tip: to pre-cut 8 pieces of medical tape and have them lying next to you also. First of all, we will start with hooking up the chest and abdominal effort belts. These belts hold the MediByte recorder in place and record respiratory effort. Make sure the MediByte is upright and facing away from you. Take the belt marked with the red tape first and clip it on the left MediByte clip. Tighten the belt as much as possible. It is much easier to loosen a tight belt on the body than to tighten a loose belt. Wrap the belt around the chest and clip into the remaining MediByte clip. Ensure the belt is located above or below the breast and loosen for a firm but comfortable fit. Take the Y-shaped black cable marked with red tape and plug one safety pin connector into the right socket located on the belt. Plug the keyhole connector into the black keyhole input on the bottom right of the MediByte labeled chest, also marked with red tape. The second belt, abdominal belt, is placed below the rib cage. This belt is marked with blue tape. As with the chest belt, tighten as much as possible before putting it on. Wrap the belt around the belly and snap closed. Loosen for a firm but comfortable fit. Take the remaining black Y-shaped cable and plug one safety pin connector marked with blue tape into the right socket located on the belt. Plug the keyhole connector into the black keyhole input on the bottom left of the MediByte, labeled abdomen and marked with blue tape. Next, take the snore microphone used to collect snoring sounds. Position the snore microphone on your forehead and secure with medical tape. Next, take the pressure cannula and thermistor, both measure airflow. Position the C-therm cannula thermistor onto the cannula. Position the nasal prongs into your nostrils, making sure the C-therm mouthpiece is on the inside, closest to the mouth. Grasp the cannula tubing and C-therm wires in both hands and wrap the tube wires over the ears and under the chin. Adjust the sliders on both the cannula and the C-therm for a comfortable fit under the chin. Place the medical tape on the wires and secure to your cheeks. You may add additional tape to help secure any wires or tubing. On the MediByte, screw the filter on the end of the cannula to the input marked pressure. It's in the center of the MediByte and marked with green tape. Do not over-tighten the filter. Next, take the Spo2 sensor. This measures blood oxygen saturation and pulse. Be sure you remove all nail polish before putting on the Spo2 sensor. Place the index finger into the rubber sensor. Tape the sensor cable with the medical tape. Again, adding more medical tape will help to secure the sensor and avoid coming off during the night. Once you are wearing all of the sensors and the leads are connected to the MediByte, the unit is ready to collect data. The unit is programmed to start automatically at the designated time we have set up. The event button is used to mark significant events during the night. For example, press the event button when turning off the lights, when getting up during the night, or upon returning to bed, etc. In the morning, push the event button and remove the tape and sensors. Please leave all cords plugged into the MediByte machine. I have supplied you with a Ziploc bag to place the MediByte and all cords in to bring back to the office. The plastic tubing with prongs that you placed in your nostrils, we ask you keep at your house should Dr. Crow need you to perform a follow-up MediByte test. Keeping this tubing will ensure that we won't have to charge an additional fee for the tubing with the next study.